Medicine is one of the most important and influential fields in human history. Since ancient times, people have sought treatments for illnesses and injuries, creating medical techniques and developing theories about health and disease. The history of medicine is a rich tapestry of cultures, ideas, and innovations that intertwine to form what we know as modern medicine. Throughout the centuries, doctors and healers from around the world have left an important legacy that has profoundly influenced the way we care for our lives and the health of people. Today, we will explore the origins of medicine, ancient medical practices, medieval medical theories, the scientific revolution of the Renaissance, and medical innovations of the 20th century. We hope that this journey through the history of medicine will help us better understand how we got here and how we can continue to advance in the field of health. But before we begin, I would like to ask you to subscribe to our channel, help us by leaving a like, and a comment at the end to let us know what you think. Let's get started. Ancient medicine is one of the most fascinating areas of the history of medicine. Many ancient cultures developed different methods of healing and treatment that influenced medical practice around the world. In ancient Egypt, for example, it is believed that priests had advanced medical skills and practiced medicine in temples. These priests are believed to have developed surgical techniques, including tumor removal, as well as embalming methods to preserve the dead. In ancient Greece, medicine was seen as a sacred science, and it is believed that Hippocrates, a Greek physician, developed the first ethical code for medical practice. He is also known for developing the Hippocratic Oath, a commitment that doctors make to this day, swearing to practice medicine ethically. In ancient India, Ayurvedic medicine has been practiced for over 5,000 years. Ayurvedic medicine is based on a series of ancient texts that describe diagnostic and treatment methods for a variety of diseases. It is believed that Ayurvedic medicine influenced traditional Chinese medicine. In ancient China, medicine was practiced by healers who used techniques such as acupuncture, massage, and herbal medicine to treat illnesses. Traditional Chinese medicine is believed to have been developed around 200 BC, and it influenced medical practice around the world. In all of these ancient cultures, disease was believed to be a result of an imbalance between the body and mind, and healing required restoring this balance. Each culture developed different methods to diagnose and treat diseases, but they all shared the belief that healing involved harmonizing the body and mind. Although ancient medicine produced many valuable techniques and knowledge about health, some of these practices were also harmful and dangerous. For example, ancient surgical techniques were not as advanced as modern ones, often resulting in infections and death. Additionally, some ancient cultures used toxic substances such as arsenic and mercury in their treatments, which were dangerous for patients. Despite these limitations, ancient medicine is a rich and fascinating area of the history of medicine that helped shape medical practice around the world. Even today, many of the practices and ideas developed by these ancient cultures are used in modern medicine. And the knowledge accumulated over centuries continues to be a valuable source of inspiration for doctors and researchers around the world. The Renaissance medicine, which took place during the 16th century in Europe, was a period marked by the transition from medieval medicine to modern medicine. Renaissance medicine was influenced by the philosophy, science, and art of the time, and was characterized by a more systematic and scientific approach to medical practice. One of the most important figures in Renaissance medicine was Andreas Vesalius, a Belgian physician who is considered the father of modern anatomy. Vesalius published the book De Humani Corporis Fabrica, which described human anatomy in an innovative and detailed way. He performed human dissections and demonstrated that many of the ancient medical teachings, based on animals, were not applicable to the human body. Vesalius's work inspired many other physicians to focus on research on human anatomy. Another important physician of the time was Paracelsus, a Swiss physician who rejected many of the ancient medical practices and introduced new methods of diagnosis and treatment. He believed that diseases were caused by chemical substances and that healing could be achieved through the use of specific medications. He also emphasized the importance of observation and experimentation in medical practice. Furthermore, Renaissance medicine was influenced by advances in science and technology, such as the use of the microscope to study pathologies and the use of anesthesia in surgeries. For example, the Italian surgeon Ambroise Paré developed new surgical techniques and treatments for war injuries, as well as being the first to use ligatures instead of cauterization to control bleeding. Renaissance medicine was also influenced by art, especially painting. Artists such as Leonardo da Vinci and Michelangelo studied anatomy to better understand the human form and represent it more accurately. This knowledge of human anatomy, in turn, was useful for physicians and surgeons in performing medical and surgical procedures. Overall, Renaissance medicine marked a significant shift in medical practice, with a greater emphasis on observation, experimentation, and systematic analysis. The legacy of Renaissance medicine is evident to this day, with many of the techniques, tools, and ideas developed during this period continuing to be used in modern medical practice. Modern medicine refers to the period starting from the late 19th century, which was marked by significant advances in medical research and clinical practice. During this period, medicine underwent a radical transformation, with new discoveries in areas such as microbiology, immunology, and genetics that allowed for the development of new treatments and therapies. One of the most important discoveries of modern medicine was the identification of microorganisms as the cause of many diseases. The work of Louis Pasteur and Robert Koch was fundamental to this discovery, with the germ theory widely accepted as the explanation for many infectious diseases. This led to the development of antibiotics and vaccines, which helped eradicate or control many infectious diseases. Another important discovery was the understanding of the immune system and how it protects the body against infections and diseases. The research of doctors such as Paul Ehrlich and Elie Metchnikoff led to a better understanding of immunity and the development of immune therapies, such as monoclonal antibodies and immunotherapies for the treatment of cancer. Modern medicine was also influenced by advances in technology and diagnosis, such as the invention of X-rays by Wilhelm Röntgen and computed tomography, CT, by Godfrey Hounsfield and Alan Cormack. These technologies revolutionized doctors' ability to visualize the human body, allowing for the early diagnosis and treatment of many diseases. Furthermore, modern medicine was influenced by a shift in the approach to medical practice. Instead of just focusing on the disease, modern medicine focuses on the holistic approach to the patient, taking into account factors such as lifestyle, diet, environment, and emotional and psychological aspects. Modern medicine also saw the emergence of medical specialties, such as cardiology, neurology, and oncology, which focused on the study and treatment of specific diseases. This led to a better understanding and treatment of many diseases, with specialized doctors in specific areas able to offer more effective and personalized treatments to their patients.